Welcome back to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And today we're going to be talking about dry needling, which is something that kind of looks like acupuncture, but needles put in the skin to help with pain, to help us get back to movement. What is it? Why do we do it? And is it actually effective? Let's check it out. Okay, so dry needling. Have you ever been dry needled?
I haven't actually.
I have, and we might talk about that story in a little bit, but let us know below. Have you had dry needling done to you? Have you had acupuncture? What do you know about dry needling? Do you have any other questions? Please comment below. Let us know what you want to know so we can get back to you. Also, let us know if there's another topic that you might be interested in us doing more videos about, because Jen has so many videos that come out week to week on different movements, different pain points that can really help you within your body. Before we move on, please hit that subscribe button and notification bell so you don't miss out on any of that information.
Because we have done another podcast with one of my good friends, Dr. Alex Anderson, who kind of touched on this a little bit in her episode.
It's a great episode just on pain neuroscience in general.
Yes.
She does a little talk about dry needling as well and where that can be beneficial, but we wanted to look a little bit into the research.
Yeah.
What is dry needling claiming to do? How effective is it? In what scenarios might it be beneficial? And we do this about a lot of these, what we call manual therapies. I mean, essentially this is in the umbrella or under the umbrella of manual therapies because it's something someone is doing to you so that we can hopefully see a physiologic change in the body and in the way that you're feeling.
And pain reduction. I think a lot of people go because it's like, oh, I have this scar tissue or this trigger point and I'm going to go and get this done to help me.
And another thing we see overlap in is, with the acupuncture community and the art of acupuncture in general, it looks similar, using needles, putting needles into the body in order to feel something different. I think that there's just like a theoretical difference in what they're saying is happening or, what they're purporting is happening in the body, what
or the intention behind it.
The intention behind it.
But essentially it's the insertion of these thin monofilaments into typically muscles, ligaments, tendons, subcutaneous fascia, and scar tissue without the use of injectables. However, the needles can be inserted near peripheral nerves and or neurovascular bundles to manage various neuromuscular pain syndromes as well. However, it's primarily found in intramuscular procedures targeting myofascial trigger points. And we're going to get into it more of like how this can help along the pain journey and when it's appropriate. We looked at another study looking at organizations teaching physical therapists to look for a trigger point to search and destroy and kind of use that method of dry needling is really not evidence-based. So if we're just really using dry needling because I'm going to hit every trigger point and I'm going to help you and this is what it's going to do, like that's actually not evidence-based physical therapy. Physical therapy should be a little bit more targeted based on your pain experience and your current symptoms, not just we're going to randomly go through your body and look for any trigger points and say this is related to your pain. It has to be specific to what you are experiencing. Always. It's individual. Essentially, what we're doing with dry needling is very similar effects of what we see in a lot of different types of manual therapy that involve touch and pressure to the system. We're stimulating particular nerves or tissues by needles, in this case, which can increase the input of the central biasing mechanism. And this kind of closes the gate on the pain inputs from selected body areas. So we're essentially trying to talk to our central nervous system, talk to our brain to mitigate some of those influences of pain that's really coming and decrease that pain threshold leading to that muscle or that particular area of the body. And so it's again where it becomes very similar to someone using a massage gun in the same area, using a Graston type scraping method in the same area, using deep tissue massage in the same area, trigger point massage. A lot of these start to become very familiar, even though the idea behind dry needling is that I'm going to put it into this tight band and as I take it out, or if I put some stimulation on it, it's going to help to release that tension. But the same thing can be said in general with touch. And I think that's an important thing to remember.
Do see people have pain reduction. We do see people feel that they have more freedom and more accessibility to that area. Just like Jen said, we're just talking to the nervous system and we're hoping that we get a positive result or a positive adaptation in our body's ability to feel a reduced amount of pain in the area, feel like we have more mobility. But what a lot of the studies show is that in one dry needling session, those benefits might only last between 24 and 72 hours. So how do we get that to last longer? How do we get to have long-term change? It tends to require including some sort of active therapy or exercise therapy.
I've known plenty of patients who have gotten dry needling in the past and it didn't work for them, right? It wasn't the thing that was the magic fix as they were told. And one thing that's very beneficial in a 2005 study, they looked at the expectations and beliefs around dry needling. And this is where studies have shown that the expectancy level significantly influences acupuncture anesthesia or dry needling, with patients' optimism and anxiety playing a role. So this is huge, right? If I feel really nervous about the dry needles and I'm very hesitant whether this needling is really going to be beneficial, it probably won't. But if I am going in because I've been told from a friend or family member or the physical therapist that this is what's going to really help, this is going to release your muscle tension, this is going to get us moving again, as long as you're combining that with exercise and education, it's probably going to be the thing that's going to help because you believe in it so much. So belief and what you expect to happen plays a huge role in the actual what you're feeling. And we want you to understand why. We want you to understand that this isn't a magical fix. Unfortunately, a lot of things that we do on you is not a magical fix. You are your magical fix. Like what you do within your own body and how you're guided and educated from a clinician is going to be the most beneficial thing. And your magic pill, your magic fix, rather than what we're doing on you. What we're doing on you is just assisting in the symptoms of pain so that we can get you along that journey of movement and your own magical fix even more. Understanding, okay, when can this play a role? Is it really needed? I think you get to decide that too. If you feel like you're moving well in your body and you can just rely on exercise to help you feel something different, then I think you don't have to have the dry needling though. But if it is beneficial, then great.
Well, put the power back in the people's hands. So just looking at some studies, there was one from 2021 that showed there is a large treatment effect within 72 hours after the treatment. However, there were no significant differences found between dry needling and other therapies like kinesiotaping or manual therapy in chronic neck pain. Also, what we've kind of already said, that we will see similar changes in many manual therapies.
It's a great tool to be able to utilize. However, when we're looking overall at the evidence, it's just lower quality evidence. So we can see that it's more effective than, a sham dry needling session or just exercise alone sometimes, but still it's not the great quality of evidence that we want to see to really say that definitively and prove that. So this can be something that you include. It doesn't have to be the only way.
Yeah, this 2020 study, again, to kind of outline a point that we've brought up already, the addition of trigger point dry needling to an evidence-based therapeutic exercise program is more effective at achieving long-term functional disability reduction compared to exercise alone. And that's something we see in a lot of the other passive or manual therapies, that having the manual therapy plus exercise might show faster or quicker or better results long-term than just exercise alone. And that's something that we support. If you're using that therapy to get the pain reduction, to get the improved range of motion or mobility so that you can exercise easier and get better, faster, quicker, great.
Now, something I thought was interesting from this 2017 study we kind of looked at, in short, they're kind of is showing how dry needling, in short term and after a week, after 3 weeks, it's seeing more benefit, with exercise than just exercise alone. However, what they also pointed out, which I thought was really crucial here, is that the dry needling group who's receiving the additional procedure also spent more time with the physical therapist as a result of getting this extra treatment. So you're not just working with a physical therapist or an aide who's doing, exercise with you, but you're also working and spending a little bit more time with the physical therapist, which that alone can be more beneficial because you're talking about what's happening. I've had patients cry on the table when we spend more time together. We're getting emotionally to understand deeper the whole biopsychosocial social model of what's happening with your pain, what's happening within your life that could be contributing to this pain. So is it the dry needling alone that's really helping? Or is it the fact that you're spending a little bit more time with a physical therapist, able to talk through things that are happening, getting more of that socialization, that connection, which also helps to reduce pain symptoms? Thanks so much for joining us on another episode from the Optimal Body Podcast. I hope you learned a lot about that, with what really is dry needling, when is it effective, when should you use it, and do you need it? What do you think now after listening to some of the research and our thoughts on it? I think it's really interesting to keep diving into these topics. So if there are other treatments that you've had done or you've been told you have to do this, please drop them below. Let's review it. Let's see what the research really has to say, and let's talk about it.